Just an honor to be here with you today and to have an important dialogue. The intent here is to discuss how public health and philanthropy can work together to accelerate CDC's 618 initiative, which you'll learn about this morning if you don't know about that, and other health-related partnerships at the state level. I started my career actually in rural Tennessee as a family physician with the National Service Corps commitment. So I've got a soft spot for the rural communities as well. And I will tell you, I wasn't in practice very long before I started seeing some real heartbreaking cases of folks coming in that had conditions and diseases that could have been prevented had we had systems in place. And I realized, boy, this goes way beyond the walls of the individual practitioner. So I'm really excited to move into the panel and discuss with all of you the 618 approach.
CDC 618 initiative is really in response to the rapidly changing healthcare sector. Things are changing rapidly, and this is actually ripe for public-private partnership. The 618 is named primarily for the 6 high-burden, high-cost condition areas: asthma, tobacco control, antibiotic resistance, preventing unintended pregnancies, hypertension control, and diabetes. And so we've been working with states 16 states, the District of Columbia and Los Angeles County, and they've been selecting some of these interventions to implement.
So in Rhode Island, the opportunity to partner with Philanthropy is endless, and we are investing time in aligning our goals, with Philanthropy and hoping to understand what impacts Philanthropy would like to have and balance that with the impacts we're looking to have so that our priorities can be along the same level. So there's 2 major approaches that we've been able to categorize and outline. One is to shift those investments from healthcare to the community by going directly to the community with those investments. And that's where our Health Equity Zones initiative is based. The second major approach is to go through the clinical setting into the community to really have those impacts and really shift the lens or the framework through which we look at what goes on in the clinical setting. The CDC 618 initiative is an excellent way to fulfill that approach. And I can start with that. How we have addressed that in Rhode Island is with our asthma and our tobacco program. What we've seen with that home asthma response program, actually regionally, is significant savings in healthcare costs. So the CDC 618 model that we approached with that really allowed us to partner with our Medicaid sister state agency and bring this concept to the forefront. And it's really because of it now we're able to have ongoing discussions about community health workers and what it means to invest in that model and being able to connect the clinical setting to the community to get the outcomes that are needed. That's the backdrop for what our ASTO focus will be during my term as president. Our president's challenge is building healthy and resilient communities.
We have a mantra at the foundation that we want our work to be grounded in science, built on partnerships, and focused on results. And truly, nothing comes closer to that than the 618 initiative. 3 examples. Our early work on asthma involved a number of new partnerships, and in that particular case, it was focused on childhood asthma, school-based interventions, a 4 to 5 year effort. And for us, it was a really deep engagement with schools. In our work around obesity, we work with county commissioners and mayors and city planners to focus on the built environment, a brand new set of partners, and clearly we wouldn't have achieved some of the policy outcomes that we did without having engaged them. What I'm most excited about is the initiative that we've just launched as of a year ago. We've funded 11 communities or counties in the state of Georgia. So overall, we couldn't accomplish what we do as a private statewide independent foundation with not a lot of other philanthropic resources. So it's been really valuable to us to reach out to public health, academia, the usual suspects, if you will, in order to make change happen in the state of Georgia.